So, welcome to this episode of Menopause Conversations. I'm delighted to have my next guest on. Have we got a treat for you? We're going to be talking all about sleep and breathing efficiently. So, not just any old breathing, the efficient type of breathing. I'm delighted to welcome my guest, Dr. Louise Oliver. Hello, Louise. How are you?
Hello, thank you for having me on. I'm really excited to talk to you.
Oh yeah, me too. And Louise, no less, has been recently speaking to the wonderful Davina McCall all about breathing efficiently because it's so important. But Louise, we've got so much to talk about because you are so interesting. You've got such an interesting topic, and there's pretty much nothing you don't know about this topic. But give us a little introduction about yourself, who you are, and how you find yourself in this space talking about breathing efficiently and sleep.
So I'm Louise. I'm a GP. I've been a GP for over 20 years now. And I've had an interest in women's health right throughout that period because I learned how to fit coils and contraceptive implants at the beginning of my career. About 5 years ago, I chose mindfulness at an appraisal. It was a really bizarre moment. And then I've just gone on a journey of just sort of understanding the body in a deeper way. But along that journey, I became a perimenopausal snorer and my sleep deteriorated and other things. And then I realized actually how we breathe matters and we can change how we breathe. So I recognized I wasn't breathing efficiently. I improved how I was breathing and my snoring stopped. My sleep is the best it's ever been. And now I can run with greater ease and my stress resilience is loads better. And I want other people to know this. So for the last couple of years, I've been coaching people to help them breathe more efficiently.
Wow, I mean it's phenomenal, isn't it? Just in terms of the whole sleep topic, compared to 40 years ago, more of us are insomniac and struggling with our sleep than at any other time. We know that the World Health Organization has appointed that blue light is a known carcinogen. So the more we're on our devices and stuff like this, it's got very, very real impacts, hasn't it? And particularly given that this is menopause conversations, the statistics are quite, damning in terms of how we sleep as perimenopausers or postmenopausers. So I was particularly interested to talk to you because sleep is something that we all need and we function better. Our mental health is better if we're sleeping better. But I don't know that many people have made the connection between breathing. So coming back to your personal experience then, which happened first, your awareness of breathing or the fact that you weren't sleeping very well, or was someone else not sleeping very well? I mean, how did it come to your attention?
So
I'm asking for a friend.
Certainly my husband told me that I was snoring. So I knew my sleep. I wasn't waking up feeling refreshed. And I was waking quite frequently in the night. Then my husband been elbowing me to get on my side because I was noisy, and then you end up in separate beds because he doesn't want to sleep next to someone who's noisy, and that's not great for a relationship. But ultimately, I got grumpy because I wasn't sleeping well, and then I'm noisy and affecting his sleep. So then you end up in separate beds. And then I'd already made a connection between breathing and how it changes our physiology. And then I started reading more about it. And then I understood that as women go through the menopause, from perimenopause to postmenopause, we are more likely to breathe, have what we call sleep disordered breathing, so not breathe as efficiently when we're asleep. And then I recognised I had quite a defensive reaction about it actually when I read the definition, the American definition of sleep disordered breathing, and I clicked off and thought that's not me. And I had quite a defensive reaction. So if anybody's listening to this and feels like that, I felt like that. But then I sort of let it sit for a bit, and then I came back and read it again and thought, right, okay, well, I've got no idea how I'm here, but let's not judge about how I've got here, but I am clearly heavily snoring. What am I going to do about it? I now know how I got to that, but I just then focus on what I could do about it. And there's loads we can do about it. And sleep disordered breathing is essentially, it's sort of like a spectrum. So at one end, we've got obstructive sleep apnea, where people actually stop breathing whilst they're asleep, and there's lots of risk to health with that. And then you have sort of heavy snoring, and then there's an increased resistance to the air coming in and out. So it's like a spectrum, and people can be anywhere on that spectrum. But you can improve how you breathe when you're awake, which then changes your unconscious breathing pattern. It takes time, but then that helps to improve how you breathe when you're asleep.
Wow, that is really powerful. So I almost don't know where to start. So so tell us then, maybe, so it's not a known symptom of perimenopause, but what we then is what you're saying is it just becomes more apparent possibly during that time, or is there something structurally or physiologically changing as a result of our hormones declining, Louise? Can you connect the dots on that for us?
So as you're probably about to guess what I'm about to say, there's not enough research on it. So
Okay.
we need more research on it. But quite clearly, for a number of decades, actually, the research quite clearly demonstrates that the increased risk of obstructive sleep apnea as women go from perimenopause to postmenopause. That's well documented. We've got circadian rhythm experts stating that. We've got people in the sleep medicine world who know that menopause is a risk factor for obstructive sleep apnea. We're not talking about it enough in the menopause space. But women often present differently. They don't come to the doctor and say, oh, I've got gaps in breathing or I'm heavily snoring. They complain of waking with a headache, feeling fatigued, having nightmares, feeling exhausted. They present with different things. And unless the health professional is asking the question, the people just don't make the dots. And there's different reasons why we're not completely clear why it happens. So these are the aspects that are important. So unfortunately, the first place we put on weight is our tongue and the back of the throat.
What?
Yes, I know. I didn't know it until I went on this journey. So you can put on a few pounds and you automatically have made your tongue a bit bigger and around the back of the throat, and that narrows the airway. So
I'm
that's
honestly in
disappointing.
shock about that. So that's one of the first places, your tongue and your airway.
Yeah, yeah,
Wow.
yeah. So that's one issue, obviously. But even when the scientists, they know, obviously, if you put on weight, you're more likely to have obstructive sleep apnea. We know that. But they did clever things and took that out of the studies to remove that as a confounding factor, and still there was this increase. Now, there's different aspects to it. Progesterone seems to have a protective effect on the airway. It seems to help the tone of the airway at the back of the throat. So when we lose that progesterone, it tends to get a bit more baggy, so it's more likely to collapse, which is obstructive airway, obstructive sleep apnea, or vibrate, which is snoring. However, it's more complicated than that, because when you look at the studies of, if it was just progesterone, you think if you gave people progesterone, well, that would just sort it out. And it's a mixed bag. But again, there's not enough studies, and the studies that I looked at, a lot of it was synthetic progestogens. Obviously, we don't really use now.
No.
I went on HRT, which helped 3 out of 4 of my symptoms, but my fourth symptom, snoring, wasn't helped by HRT. I think some women are helped by HRT. It's a mixed bag, I think.
Yeah.
But the other thing is, if we think about it, all our muscles from, I think it's in our 30s, unless we're actively training them, those muscles get weaker. So we accept that, don't we? We understand now the importance of strength training. Well, why are we not talking about the muscles of the airway?
100%.
Yeah. If we're not training them, they're going to get baggier and more likely to collapse or vibrate. So actually, we should be thinking, are we doing some strength training for our throat and tongue? And also, this is based on my personal opinion, based on my clinical experience. I haven't got scientific research I can back this up with, but I personally think women, as they go through this transition period, I think they become more intolerant to carbon dioxide, which makes us breathe faster, which makes us over breathe. And then if we're shifting more air in and out of our airway, it's more likely to collapse or vibrate. But we can change that. You know, that's one of the things that I coach people with, and it makes a massive difference, but there's not enough research on that. It's difficult to research.
And this is the thing. I'm just going to check my thing. This is the thing that's so frustrating, isn't it? Because I'm a bit like this about histamine intolerance. The science is there, but the research hasn't caught up to give us the population sizes and the data that we need so that we can categorically say it. And this is one of my biggest frustrations, because we know that we can still get benefit for people even though we don't have these big randomized controlled, placebo controlled studies or whatever. But so this is really powerful stuff. So take us through them. I mean, what do you want to do? Do you want to define what breathing efficiently is and then tell us about your 3 A's? You lead the way. I'm all ears.
So first of all, I think I'd like, if hormones affect how we breathe, and obviously how we breathe affects our health and well-being. So we've got that's one thing I didn't mention. We've got hormone receptors in all parts of our, in our breathing center, at the back of our airway, in our lungs. So it's completely realistic that if our hormones change, it's going to affect our breathing. So we know that. But I want people to be aware that just because breathing is generally automatic, it doesn't mean it's automatically efficient.
Oh, that is such a good caveat, isn't it?
Yeah.
Okay, great.
And because we're not living, so this is harking back to the point that you've made, because we're not living necessarily as we've been biologically programmed to live, then we're not breathing necessarily as we've been biologically programmed to breathe. So I think if we're all living as cavemen, I think probably we'd all be breathing quite efficiently. But we're living in a modern day society which fuels a fight-flight response. And if you think about it, let's give you this example. So I was running, someone with a dog accidentally let go of the lead. So the dog came up to me and I thought I was going to be attacked. So there was no thought process in it. How did I breathe? I was like, so I was upper chest, loud, mouth open. And that was a good thing, because my fear center spies on my breathing center, and it sees me changing breathing. Oh my goodness, she's having a threat. And then it sends a signal all around the body to put me into threat response. It puts me into that fight-flight response. Luckily, the dog owner came, grabbed the dog and said sorry, etc., and took the dog. And then I knew, because of my breathing work, well, now I'm safe. I need to now tell my body I am safe. So I shut my mouth. I breathed slowly and gently, and then it sent a signal around my body now that actually she's safe now. You're not threatened, and now more that relaxation response, that parasympathetic nervous response could turn up. And people don't recognize that. We've got more nerves going from lungs to brain than brain to lungs, and we can be in charge of that. So first of all, people be aware that there's this spectrum. We can breathe efficiently, inefficiently, or anywhere in between. And how we breathe directly tells our body either we are threatened or we are safe.
Yeah, and that is so powerful. We put that into all our programs, Louise. We talk about, you can't be stressed and sexy, is what I say, because I know that gets people's attention. They're like, what are you talking about? And it really is one or the other, because it's a survival mechanism, and when cortisol is involved, cortisol is vital for life, isn't it? But not in the amounts that we experience it in 2024. And it's got such a long half-life, hasn't it? I mean, some people talk about it hanging around for about 72 hours. So if what we're saying is cortisol is part and parcel of that equation for efficient breathing or inefficient breathing, if it's hanging around and you're chronically stressed, then that's one of the places that's going to show up. And I can honestly tell you, the more I've heard about it, and in the last 3 years I started meditating, I think I must have been using the top 10% of my lungs, just sat here in my office every day.
Yeah.
And then wondering how going up a flight of stairs was a bit of a problem for me. It's because really we're just only shallow breathing here. So unless we give our body that frame of reference, like you say, we don't know what we're fully capable of, do we?
No, exactly. And actually, what's interesting, the other thing I've not mentioned, the way our ribs are hung onto our spine is different, women and men. So women, so if I'm like this, so our ribs are slightly hung like this.
Yeah.
Thinking like that, so that when we get pregnant, there's space for the uterus to come up. Whereas men, it's like this. So men are more likely to diaphragmatically breathe because their ribs are horizontally hung. Whereas women, we're more were put at an angle, so it promotes an upper chest breathing pattern. So I think that doesn't. And then the other thing is, and I remember being told by a pupil at school when I was, I think, probably 10. That person said to me, "Oh, your stomach looks big, Louise. You need to pull it in." And I actually wonder whether I started to breathe inefficiently from that moment, because I was holding my stomach in.
Wow.
Freezes your diaphragm. And then was that the moment that I started to not breathe? I don't know. But when I've reflected, I think I've spent a lot of time holding my stomach in and then probably not using my diaphragm.
Well, this is so powerful. Now, I'm going to take a massive leap here into that. When my daughter was born, and she was born by cesarean section, and there's a correlation between colic and babies born by cesarean section, that their diaphragm, because they haven't come through the birth canal, the diaphragm hasn't been properly squeezed and adjusted and pinging back into place. And so there is a correlation between cesarean births and colic. And so it's possible, isn't it? I mean, how many of us have been through a generation where, because of narratives like that, we have sucked in our bellies, or the corset wearing era. I mean, I know Bridgerton's very popular at the moment, so shout out to the Bridgerton fans. But it's all of that, isn't it? You know, anything like that that's suppressing or even collapsing. Like, here I am, I'm going to change my posture. But actually, we've had a posture consultant on as well, saying about breast heaviness and how that collapses down. But I did not know that about our rib placement. That's fascinating.
Exactly. And you can't, if you've got poor posture, you're not going to breathe as well. And that's one of the things you sort of imagine, almost like you've got a little string at the back just gently pulling you up. And then at least you're giving yourself a chance to breathe properly, because you're not, you know, and obviously people are like this on their phones, all this sort of thing.
And tech neck, you know, the old tech neck, that can't be helping, can it?
No, exactly, because you're crumpling, you know, you're constricting your airway. So I think it's, first of all, people need to be aware that how we breathe matters.
Number one,
and we can so awareness. We need to be aware, particularly if we're going through the perimenopause to postmenopause transition. I think every woman needs to know, my breathing might become more efficient. So, you know, I would love a day for people to know, to say, right, what are the things I can do to prepare, you know, as I'm coming towards a perimenopause. I would love it for people to know, my breathing might become inefficient, so I'm going to assess my breathing now, and actually, if they recognize it's not quite so efficient, actually, you know what, I'm going to improve my breathing efficiency before I hit there. So it's prepared.
How do we assess it? Because of course the scientist in me is already going, okay, got that. How do we actually assess it then?
Well, this is the really, really frustrating thing at the moment, and this what makes it really difficult to research. At the moment, we do not have a gold standard assessment that everyone agrees on assessing breathing efficiency. So
that's how unhelpful. Why is that? Can you just tell us why that is then? Why is that? Why can't people do it?
Because breathing is really complicated, and you can breathe inefficiently in different ways.
Right.
But it takes it it's very difficult with a study, isn't it? Because if I need to be able to have an assessment tool that I do before and after my intervention to prove whether I've improved things. We don't have that. Now, someone's doing a PhD on it, so I'm hoping this may change. Right. So hopefully, fingers crossed. But essentially, so what I have to, I've got a video on my YouTube channel where I explain it, but I'll give you some nuggets here. So these are my thoughts on it.
Yes.
So the mouth has absolutely no role in breathing. Right. No role. The only role it has in breathing is making it inefficient.
Right. So that's how we know then.
Yeah. So just prospectively, I've had so many people, I definitely nasal breathe, and then I say, well, just observe, just notice over the next week. And generally people are mouth breathing more than they realize sometimes. So you need it, particularly when you're distracted. So when you're on your phone, the TV, you're doing an email, you're walking from the house to the car, up the stairs, just notice, how are you breathing? And if you're using the mouth to breathe, that there's some inefficiency there. Observe how you breathe when you wake up. So when you wake up, is your mouth open? If your mouth's very dry, you've got a lot of nasal congestion, you've got a lot of drool on your pillow, all those things are suggesting that your mouth's open. Ask your partner if they get up. If you've got a sleeping partner and they get up to go to the toilet, just ask them to have a little look, and just see if your mouth's opened or closed.
Yeah.
It's because sleeping with your mouth open, it will it completely sets up the body not as it was designed to breathe. So that's one way. Just start to recognize, and the more mouth breathing you do, the more potential you have for not breathing efficiently. That's one bit. The other thing is there's an assessment tool that was used in a paper, so there is some research on it. So essentially, you do a comfortable breath hold time. So they wanted to know, so you measure your comfortable breath hold time, and then you ask 4 questions. So one, and it's if you're saying you'd answer often or very often to these questions. So one is, do you feel tense a lot of the time? One is, do you sleep with your mouth open? One, do you yawn a lot? Or you could say sigh a lot. And the other one, do you have cold hands and feet? So if you answer often or very often to one of those questions, and your comfortable breath hold time is less than 25 seconds, that suggests some inefficient breathing. So I do explain that on my YouTube channel, which is Dr. Louise Oliver TLC. There's a video that says how to assess your breathing efficiency. And essentially your comfortable breath hold time, what you do is you just close the mouth, you do a normal breath in, normal breath out, and you pinch and hold. And you've got enough oxygen in your lungs that you're not going to drop your oxygen, and you're just holding your breath, and you're timing the number of seconds until your body sends a first signal to breathe. So it's not a maximum breath hold. We're not doing any competitions. Or when you hold your breath, you're not releasing your waste products, your carbon dioxide's going up. When it hits your tolerance, your body literally will send a signal to breathe. So it'll be a squeeze in your neck, a squeeze under your ribs and your diaphragm, or some people have had it felt in their chest. And it's your body literally sending a signal to breathe because it's reached its tolerance to carbon dioxide. And if it's less than 25 seconds and there's a yes to one of those questions, that suggests inefficient breathing. But for really good breathing, ideally, you want it to be over 40, ideally.
I already know for a fact the amount of people who, as you have just said, that are probably going 40. Thought she said 40 for a minute there. I think most people would probably think that they're in that then, aren't they? Whether they're snoring or not. It's
and the difference. So I think my comfortable breath hold time was probably around 15 when I started. I've worked with people who've had a comfortable breath hold time of 3.5 seconds, and they have really, really when this is spectrum of breathing efficiency. So obviously, when you get someone who's breathing really inefficiently and you move them to efficient breathing, it's life-changing for that person. That person who had a breath hold time of 3.5 seconds, it literally is life-changing. Obviously, if you're not so inefficient, it's not quite so life-changing. So I was about 15, but the difference in my breathing from having a comfortable breath hold time of 15 to 40 is just unbelievable.
I'm even trying it now as you're speaking, and I don't think I can get beyond about 15. I mean, I do quite a lot of meditation. I mean, is it possible? I mean, I disclosed to you before we started recording. Now, I've got histamine intolerance, so I've got problems with my DAO pathway. So, and we're in pollen season, so I've got a snuffier nose. I've got congestion in the back of my throat, and sinus airways. I mean, surely that must be also being impacting our ability to breathe efficiently. But does it also mean it's probably even more important that you do learn to breathe efficiently than if you've got all that going on?
So obviously we've got a natural pollen filter, like filter for anything. So when I first started going down this route, I used to do all my running with mouth breathing, and then I read that essentially I'm just bringing any virus, bacteria, pollutant, pollen, I've got hay fever, straight into my lungs. And I had this moment, when you have almost like scales come off your eyes and think, oh gosh, all that running I've done next to the roads, and I've just taken it all. And the nose won't filter out everything. It doesn't filter out the really tiny particles, but it's much better than having no filter at all. So I think if you've got any sort of histamine or allergies or hay fever, the importance of 24 nasal breathing is not to be underestimated. And I can say this year, I think my hay fever is gone. And I think this, obviously I'm using my nose, so that acts as a filter. But I think because I breathe in a way now 24 hours a day that tells my body I'm safe, I don't think my autonomic nervous system is as reactive to pollen. So obviously I've reduced the pollen load by using my nose, but I think generally I'm more parasympathetically driven because of my breathing pattern 24 hours a day. And I think that has contributed to me now. I would say this year, I don't feel I've had hay fever
Amazing.
symptoms.
That's
So
amazing, Louise, because I coach so many women who have histamine intolerance driven by slight estrogen dominance,
yeah.
either with or without HRT. So this could be massive. This could be
And
huge.
do you know that estrogen can cause nasal congestion?
Yes, I do, because every time I used to take my HRT in the morning, by the time I was on the school run, I looked like Rudolph to pick my daughter up. And I was convinced, and I had to go and say to my doctor, that's how I diagnosed myself with histamine intolerance. I said, do you know what? Every time I take it consistently, 3 o'clock in the afternoon, my nose lights up like a light bulb, and it was swollen.
Yeah. So I've spent more than 20 years trying to help people with nasal congestion, with varying degrees of success, despite loads of nasal sprays and antihistamines and referring
Yeah.
people to ear, nose and throat. I've had more success as a breathing practitioner curing nasal congestion, because the nose is a use it and lose it organ. We've got erectile tissue in the nose that's very similar to the genitals in the turbinates. So essentially that can swell up with blood and then nasal congestion. But if a person doesn't, but the trouble is then when your nose is congested, you start to mouth breathe, but the nose is a use it or lose it organ. So the more you use your mouth, the more the nose will block. So it's
Right.
getting,
So
and
it's almost like the opposite, isn't it? It's like when you've got a urinary tract infection, you withhold from drinking water, when in fact the thing that you really should be doing is drinking more fluid, isn't it? So that's really what you're saying. It's like actually you have to push on through and keep using that. And I love what you said there before about you're sending signals that this is not a threat to your own body. And I think there's so much in the menopause transition that we underestimate about mindset and about the capacity of our brain, because it's a neuroendocrine experience, isn't it, menopause? So actually leaning in fully into those alternatives, because HRT is not the panacea. There's other things that we need to be considering. That's really powerful. Right, so we've really lent into the assess there. Is there anything else under the assess bit that we need? Because there's a lot there.
No, I think that would be and I suppose the other thing is observing how you're breathing. So obviously, if you're someone that you can see your shoulders move as you breathe, then you're using more the upper chest. So you could even put one hand here, one hand here, and just observe. If your lower hand is moving more, but if the upper hand is moving lots, then you're more upper chest breathing, which is not as efficient. Ideally, the lower ribs should move out as we breathe in, and as we breathe in, the lower ribs should go out. Then as we breathe out, the lower ribs come in. So that's how we should breathe. So it's just having a bit of awareness. And if you're upper chest breathing, there's some inefficiency there as well. So
and it's the opposite really of that whole belly sucking in. One little thing that we like to do when I do resilience workshops is actually falsely elevate people's heart rate, and then through breath work actually bringing it down. And it is that whole observancy, a bit like you're a bagpipe. We were talking about Scottish reference. I told you I'd get it in. And actually it's like that, isn't it? Almost like seeing yourself like that bellow and full expansive breathing. And actually for people who do mindfulness or meditation, I love guided meditations. We laugh in my house because it means I'm going to sleep basically. But that's when those deep breaths come. So it is that retraining, isn't it? I mean, It's fantastic. So let's imagine, yeah, okay, we had the awareness there was an issue that we're gonna assess to what extent, and you've given us loads there, and obviously yes to watch your YouTube channel. How do you translate that all into then the action part?
Action bit. So there's lots of different bits to it, and what if there needs to be a recognition that you're trying to retrain your body consciously, so your unconscious breathing pattern is improving. So obviously that takes time, because if you're trying to make something an unconscious habit, you're looking at least 3 months, aren't you? And
Yeah.
I've worked with people who recognize in retrospect they've not been breathing efficiently. I think 60 years is the longest that I've worked
Wow.
with someone. So you're unpicking nerve connections and muscle memory of 60 years. Hopefully I would like people to recognize it before then, but it can be changed. It just takes longer the longer you've been doing it, and it doesn't take 60 years to unpick again. But so there has to be a recognition that this needs some gentle work every day to change. So over time, your unconscious breathing pattern becomes more efficient unconsciously. So you're talking at least 3 months to get that muscle memory nerve connection. And we've got to think of it in two different ways. So we've got to think about the airway and how we can get that open and strong. And then we've got to think about sort of the air that's coming in and out. So if we break it into two, so I'm not sure if people know, but we've got an airway, so the tube that we breathe in and out of here is actually, it's only about the size of a thumb. It's not very big at all. And we want that to be as open as possible, particularly when we're asleep. And it needs to be as strong as possible, and it needs to be combined with nasal breathing. So there's, I don't know if you know, but there's a correct tongue position. There's throat exercises you can do to strengthen that, and we need to be nasal breathing. So people, tapping, just if they're sat there, mouth open, just think, oh, well, just get my mouth closed. And one of the things is, if you've got your mouth open when you're asleep, is getting the mouth closed. I prefer people to wear something around the mouth. If the body still needed to breathe out, they can do, and that's really important, particularly if people have very heavy snoring or potentially obstructive sleep apnea, because if you fully tape up, and I know there's a lot of talk on social media, you can do something like the person can't actually get the air out, and actually that can actually splint the back of the airway, and actually make sleep apnea worse. So there was a study that just had, like what James Nestor says, just like a little bit of tape across here, and it was in people who had mild obstructive sleep apnea, and there was a massive improvement in, I think 47% improvement in snoring, 47% improvement in sleep apnea. But 3 individuals, it's a very small study, 3 individuals, their snoring index got worse.
Right.
And I suspect that's because, and that person is, because if you've got the mouth closed, you've not corrected the other aspects of breathing, you've just closed the mouth. And often people who are snoring off, and I was like this, I was over breathing, so I was breathing in excess of what my body requires. So then you're shifting too much air in and out, and by getting that close, you haven't corrected that.
No, you've just made it. You've just shut. That's a bit like just shutting the door and hoping it, almost behaving like it doesn't exist type thing, isn't it?
Exactly. So I always try and encourage people to use a product that goes around the mouth, and then if the body does need to breathe out, it can do. So there's that aspect. So it's sort of tongue position, it's muscle strengthening, and it's 24-hour nasal breathing. And then you've got to look at the other aspect is looking at what air you're bringing in and out. So is that person over breathing? Well, if your mouth breathing, your mouth's bigger than your 2 nostrils. So it's, by definition, as soon as we move, there's a very small study that it was quite a clever study, but it was only a small number of individuals. They measured them going from nasal to mouth breathing, and every minute you're breathing an extra 800 milliliters by going from nose to mouth breathing.
Wow. And you know, this is so powerful in a totally different context. My sister had to have major surgery for endometriosis, and
Mhm.
part of her bowel was strangulated by endometriosis tissue. So she had to have it removed. So, of course, she had a stoma fitted. And part of how she processed that, she was told that in no circumstances was she to talk during eating, because the amount of extra air that would put in, and it would mean that the stoma would struggle to work. So we've got a few little gremlins, but that always makes it even more important to keep going. So we just froze for a little bit there, but we're back. We're back. So yeah. So you know, the whole thing about breathing is really really powerful. And I always notice that if I've been talking, like we had a pavlova yesterday, high cream, sugar, and I was talking loads, and then I noticed I'd got hiccups. So there is
Yeah,
something around all of that. So basically I took two things away, but I just wanted to come back to the strengthening the airway, and you talked about the
yeah,
position of your tongue.
yeah.
Can you tell us just a little bit more about that? Because you talk about, and I'm constantly telling anyone who listen, you meant to have the your tongue in the roof of your mouth. Did you know that? So can you tell us
So,
why that's important?
so it's important because the tongue is it's a muscle, and very strong muscle, but it's only attached to a bone at one end. So the bone it's attached to is here. So if we have our mouth open, it automatically it's lower down in our mouth, and the back of the tongue is part of the airway. So if it's in the bottom of the mouth, it's too far back and it narrows that tube. Whereas if we've trained our body that the tongue's on flat on the roof of the mouth, you'll feel it lift here. So as soon as you put your tongue on the roof of your mouth and sort of you feel it lift up, don't you? Yeah, because you're lifting your tongue, and because it's attached here, it lifts it up. Tiny bit of suction pressure on the roof of your mouth, but not enough to give you a headache. The tip of the tongue, you don't want to rest on the back of your teeth because it's a strong muscle and you'll end up with buck teeth. So you want the tip of the tongue to be on that ridge of tissue that's above the back of the teeth. You want your lips to be sealed, but you don't want to clench, because if we clench, we're stimulating that fight flight response. So for me, some people can have their teeth in light contact, but for me, if I do that, I clench. So I have a little tiny gap in between my teeth. And every time I get a glass of water, go to the toilet, wash my hands, I just say tongue in my head, and I just check my tongue position. It's normally in the right position now, but it peppers my day with some mindfulness, so I still do it. So
Yeah,
because it takes it out
brilliant.
of my.
Brilliant. So is that generally how we strengthen it? Or, I mean, obviously people watch your YouTube channel. Are there specific exercises that you can do, or is that a good place to start?
So I'd say that putting the tongue in the correct position is a great place to start, because I have to say, when I started doing it, I got you actually get you ache here and you ache here, because if you've not been doing, if your tongue's not been in the correct position, and your tongue can be a little bit weak initially, and actually just doing that helps strengthen it. But there are some specific ones as well that you can do to strengthen the back of the throat as well, but that's a great place to start.
And we know, don't we, as people get older, I can remember when I was in the pharmaceutical industry, we used to talk about people who have dysphagia and all sorts of things, and you lose your swallow reflex. So it makes sense, doesn't it? Like you said, like any other muscle, we need to strengthen that. I mean, I'm constantly, I've got my head forward as well, you know, putting your head correct positioning and stuff. It makes a massive difference. And someone told me about the weight of your head, you know, as every degree of angle coming forward, you've just made it heavier and heavier, which is effectively crushing
Yeah,
and weakening that, isn't it? Well, this is
definitely.
fascinating. Okay, so we've talked about strengthening the airway. Tape, and we're not saying tape's unhelpful, but we're saying it's not a solution. And I told you personal anecdotal stuff about that before, which is brilliant, because you just you strengthened my argument anyway. So and over breathing. So is there any more we need to know about over breathing?
Yeah, so I think this is where I personally think this is massive for women. I think so. Essentially, and again, there's not so much research in this, but so I'm basing a lot on this on the work that I've done with individuals. But this is real, and this is what makes a big difference. So essentially, you know, if you and I were at the bottom of a hill, And I said to you, right, we're going to march up a hill together, but you can only do it with nasal breathing. So we'd walk up there, and at some point you'd feel suffocated, and you'd feel it different. So either you'd feel suffocated, you'd feel anxious, or you feel like you're not getting enough air in, or you feel like you want to take a bigger breath, and you feel like you want to open your mouth. When you hit that, you've hit your carbon dioxide tolerance. So you're marching up the hill, you're creating more waste product, and we've got these receptors in our breathing center that essentially when we hit that tolerance, it sends a signal, it sends air hunger. And if we had a lot of individuals doing it, there'd all be different points up that hill. So I would now be able to go much higher up that hill because I've trained my carbon dioxide tolerance. I'd be able to go much higher up whilst maintaining nasal breathing. Perhaps you might not do. But that you can train your body to be more tolerant to carbon dioxide. And the wonderful thing about carbon dioxide is, well, various different things, but two things. One, it actually helps release oxygen to the cells. So that's what makes it, then actually breathing, but you're more likely to remain in aerobic metabolism and create less oxidative stress to your body if you can stay in aerobic metabolism. So you can do a lot more exercise before you feel suffocated. But carbon dioxide as well is quite, even though you don't, obviously when you feel air hungry, it doesn't feel calming to the nervous system. But actually carbon dioxide it's a narcotic gas. So to the central nervous system, you could actually anesthetize someone with carbon dioxide. So once you get used to carbon dioxide, it's actually very calming and it can feel quite relaxing. But obviously initially people can feel like, oh gosh, I've got air hunger. The air hunger isn't necessarily a bad thing.
No.
So training yourself to be more to do exercise and maintain a tolerable air hunger actually is a good thing, because you train your carbon dioxide tolerance to be better. And the other thing that happens is, so if you imagine if I'm breathing in, so like initially when I wasn't breathing in efficiently, I was breathing in and out like this. And it's what carbon dioxide is. So I breathe in and I breathe out. The thing that drives my next breath is my carbon dioxide tolerance. So it drives my next breath. Now I'm more tolerant to it. So I breathe in, I breathe out. And then what happens is, because I'm not hit my carbon dioxide tolerance, I have a pause. Oh, and now my carbon dioxide has come in. So I breathe slower and gentler. It prolongs my exhale, which actually helps that relaxation response. So your breathing pattern becomes slower and gentler and more calming. And you imagine if you're going to do a step aerobics class or a spin class, if you've trained your breathing to be slower, you can do so much more activity before you hit your peak breathlessness.
Yeah, and so this instantly I'm sort of thinking, does this mean, like, so we know for some people our tolerance to things like HIIT workouts is very different as we progress through menopause, because what we did in our 20s, I basically put on weight doing HIIT workouts. And I just walked off the weight I'd gained, 2 stone. I walked it off, and I walk up hills every single day. And I'm convinced that's where my, my better VO2 max comes from. I've got better breathing and utilization of the air that I'm breathing, because I'm not doing like that extreme cardio. Is that because what you're telling us there almost is, I mean, if you're huffing and puffing in and out of your mouth, that's not efficient breathing.
No. And you're much more likely to go into anaerobic metabolism because you're inefficiently breathing. And what's the waste product of anaerobic metabolism? Well, you're going to get your lactic acid, aren't you? It hurts. You're going to get lots of oxidative stress. If you maintain aerobic metabolism, what are the byproducts? Water and carbon dioxide. That's it. And I do appreciate if you're an athlete and you're going, you're an Olympian, you're exercising so much that actually your breathing volume may be too big to maintain nasal breathing whilst exercising. So that might be different. But even the Olympic athletes, I would say to them, have you actually ensured that you're breathing? Because if you're an athlete, you want to be stood on that start line with breathing as slowly as possible, because then you can do all the exercise before you hit your peak breathlessness. And with there's so many people that I've worked with who are absolutely amazed that they I'll give you a couple of examples. So one individual had broken their nose, I think, on a rugby, nasal congestion, saying there's no way that I can do any exercise with nasal breathing. By the end of my course, was doing 5k with nasal breathing.
Wow.
Might have been at the very hill at the last end, might have had to do some mouth breathing, but the rest of it could do. I've had a 68-year-old woman who could skip continuously for 8 minutes with nasal breathing after she'd improved her breathing. And then I've got a 75-year-old woman who was running 3 times a week before my course, but at the end of the course was doing the 3 runs with nasal breathing. So I don't think age is a barrier to this.
No.
And another individual who had quite inefficient breathing and improved it, and she gave a quote saying, I'm now in a Zumba class. I think it was a Zumba class she was going to. And she said, I'm seeing all these people huffing and puffing, having to take loads of water because their mouth breathing, they've got a dry mouth. I've just got my mouth closed and I feel calm as anything, and I recover much easier. So,
amazing.
So the power of nasal breathing and trying to maintain nasal breathing whilst exercising, but it's improving that carbon dioxide tolerance, because then you can tolerate it, and it's easier to practice that at rest with exercises that improve that at rest rather than necessarily with exercise. But just make it simple. When you go for a walk, actually think, right, I'm just going to do my nasal breathe, my walk with nasal breathing. And when you get that feeling that I've got to open my mouth, just slow down or stop, let it pass, and then go again.
I love this. I think it's so powerful. And personally, for me, I mean, my histamine intolerance at the moment is off the charts. And I could feel I had to lower my estrogen dose last week because that was being stimulated by histamine. And of course, that can make you feel a bit more panicky and a little bit more like, oh, you know, a bit all over the place. So this is so powerful because it empowers you, doesn't it? And, you know, there's so much power in taking a breath or two, and mostly through your nose, people. I think that's what we're hearing today. So, and it's not just for menopausers, is it? I mean, tongue in cheek, we spoke before, it's about the people who are sleeping next to us, because one of the things that I wanted to talk to you about is how our sleep changes during menopause. But let's say, you know, if your HRT is optimized, if you generally sleep well anyway, what can railroad it is if the person next to you is disrupting your sleep, because that can be really detrimental. Really, I hear a lot of people who say that. So it's not just about the menopauser who's got the problem sleeping, it's maybe the person next to them. So this isn't just for women and those who are female at birth. This is for everybody, and breathing efficiently. I mean, tell us some of the success stories then. I mean, you told us loads already, but what, you know, when you think particularly memorably, and what keeps you going to keep doing this work? Because it's tough, isn't it? You know, if you feel like you're pushing water uphill a little bit because the evidence isn't there, it's like, oh, how do I keep going? But, you know, tell us, you know, a memorable story in terms of people's progress with this.
So the one, I've got a blog post on this. I think the one that I think, and in the medical space, this is so important, but I am feeling a little bit like I'm trying to push water up a hill. But so I had a lady that had been 2 years with lots of different symptoms. So she'd seen cardiologist, neurologist, you name it. She'd had every test known to man, and but all the tests were normal. So everyone kept saying, well, it's normal. And she's like, but I can't sleep. My guts are playing up. She had pins and needles. So she had pins, if I remember rightly, pins and needles on her face and arm. I've got it in the there's a blog post on my website. There's if you look at medical and explained symptoms, I actually got her feedback. So she was told everything was normal, but she said, I'm not normal because I'm not well. And then I happened to be doing a breathing seminar at the weekend, and I said, I suspect you're not breathing efficiently, and I wonder if some of your symptoms are being impacted by how you're breathing. I think she thought I was a bit mad, I think, but I think she was so desperate. I said, just come on the breathing webinar, and just she had to shift around her work shift or whatever, and she came on it, and we did the comfortable breath hold time, and it was at that moment she understood she had a problem. She had a comfortable breath hold time of 3.5 seconds. So if you imagine this person, so she'll be breathing in, she'll be breathing out, she won't even have finished her exhale probably before the drive to breathe in comes in. So exercise will be out of the question, because she'd be feeling air hunger just as she's going to the toilet, walking to the toilet. So she recognized then she had a problem. She followed the exercises, got her mouth closed, did all the things that I said, and literally all her symptoms went.
It's phenomenal, isn't it? It's phenomenal.
And I think this woman was written off as like, a lot of these people would get diagnosed with anxiety or, or health anxiety and that type of thing, I'd be guilty in the past. I'd end up giving them antidepressants and things like that, because what else can you offer? And actually go back to basics. Is this person breathing efficiently? So it's triggered. So I did a blog post on that, and she's put her feedback that she's given me permission to give that. And then I've done another blog post that to try and help health professionals or people like yourselves who are working with people, where I did it in conjunction with a respiratory physio and a dentist who's got an interest in sleep disorder breathing, and I pulled together risk factors. So there's tables for symptoms, medical conditions, repeat medication, and what we'd see on observation. So the more that people have got of those things, the higher the chance of breathing efficiency. So I think in the medical space, if your health professionals keep doing lots and lots of tests and they keep telling you there's nothing wrong with you, please just assess how you're breathing. And I'm not saying that lady, all her symptoms went, she had a brilliant result. But it may not be that, but you'll only know in retrospect what symptoms. So once you improve your breathing efficiency, if some symptoms stop or improve, that was related to how efficiently you're breathing.
Absolutely. And that's the power of the scientific approach, isn't it? Having that awareness conversation. What's your baseline? Where are you starting from? Administering the intervention, and then reassessing. I mean, it's so powerful. I'm a fan instantly, I can't tell you. I'm even thinking of myself, thinking, no wonder, obviously it's all connected, isn't it? But maybe we don't make those connections because we're so used to just automatically breathing that we don't question it. I wonder how much more we would question it if we had to consciously think about every breath that we took. But that's really what you're encouraging us to do, aren't you? I always say in coaching, if we want to change a behavior, we have to go back and be deliberate about it, to be consciously competent, so that we can become unconsciously competent with something and don't even need to think about it. So is there anything else that I haven't asked you, Louise, that you think would be worth adding in right now, or have we sort of given people the mandate to start the process?
Yeah, I think you've covered it brilliantly. Obviously, I could talk about breathing forever and a day, and you could give me any symptom, and I could probably always find a way that if you're not efficiently breathing, that symptom could be made worse by it. Because if you think about it, our body has been designed to breathe in a certain way, and if we don't breathe efficiently, our body will do its utmost to survive. But then you've set your basic foundation on an inefficient basis. It can still thrive, but you're making it harder for yourself.
Yeah, and what I really like about this is when we feed into the whole narrative that menopause is largely, it's not just a biological experience, it's also a psychological. And if we are sending signals to our body that we're in fight, flight, freeze or fawn just through our breathing, that's been a light bulb moment for me today, that actually how many of the symptoms we are experiencing are because of inefficient breathing and lack of awareness, basically. So we're going to put all your details on the show notes so people can be in touch with you. I know so many of my corporate organisations are going to be, oh my goodness, how do we get in touch with her? Is that the sort of thing you would do, Louise? Do you do talks for businesses and things like that?
Absolutely, yeah. I'm happy to work. I run a group program, I run an individual program. I'm happy to come and do talks and presentations for any organizations, because this is the needs, it's so important. And obviously it may be that someone is aware, assesses, and they're breathing efficiently. Brilliant. So that's, you can go on and work on something else. But if you're not, then you've got so much to gain from improving how efficiently you're breathing. So how
Yeah.
we breathe matters. We can change how we breathe.
Oh, definitely. I'm doing a talk on resilience tomorrow. I shall be mentioning you because it is part of that, isn't it? Strategies for resilience are about how can we cope with the stresses when they do come. And usually, I think if most of us think about it, it's our breath that is probably affected first, and therein lies that rolling stone that gathers no moss. So we need to be able to sort of intervene. So for now, Dr. Louise Oliver, I feel really privileged to have met you and to seen you. And she's probably one of the most humble people I've ever met.
Oh,
You are. You're so humble about this, but I think what I like and share with you is that I certainly around histamine intolerance know there are some things that science just hasn't caught up on. And you've just given me a mandate to keep talking about it, because I think, it will happen eventually. But if we can help people along the way through as much science is currently available, why not? So do everybody check in with Dr. Louise Oliver. We're going to put this up on LinkedIn and on Instagram. I'd like to have you back, Louise, if that's okay.
absolutely.
And to have another conversation. But for now, thank you so much for your time.
Thank you.